Marybeth doesn't know that I get to introduce her. Surprise. Hi, I'm Jean Campbell. I'll be talking later, but right now I'm going to talk about Marybeth. Marybeth is, and she's going to tell her story, so I'm not going to take away from that. But Marybeth is a longtime patient advocate for the cystinosis community. And it started more than 30 years ago, more than 35 years ago, and has been part of the rare disease community ever since. Because once you join one disease state, you actually have automatic, admission into the Rare Disease Club. And Marybeth has been able to share the story about the importance of advocating not just for the patients, but for the caregivers, of which she is, for rare disease patients. And she has blossomed beyond the cystinosis community. We met 30 years ago when I was at the National Organization for Rare Disorders. And she has worked so many aspects of patient advocacy. She lives and breathes, and she will tell you that she is a wise old woman. We laugh about that. But she really is a wise woman and has experienced so much. So you will enjoy listening to my good friend, Marybeth Krummenacker.
Thank you. I think she set me up. Did she ever? Good afternoon, and thank you for allowing me to speak. Yes, I am a patient advocate. More importantly, I'm a mom. My daughter is 38 years old, diagnosed with cystinosis 35 years ago. She was, I'll go back to the day she was born, 8 pounds, 15 ounces, healthy baby. She's my second child. My pediatrician sat on the end of my bed as I'm being discharged with her to tell me, "You're a veteran. You know what you're doing. We're not going to worry about you." But in the first 3 years of my daughter's life, everything I did for her that I did for my son didn't work. She couldn't nurse. Formula was awful. She was a terrible eater. Everything. At 2 years old, she presented with failure to thrive. And we went to the specialist. I'm on Long Island. I have every resource of every hospital and doctor and specialist very easily. Did a little bit of a workup. They told me not to worry about her. Come back in 6 months. Went back in 6 months. Well, she grew a little bit. She gained a little weight. Come back in another 6 months. We'll do a whole year evaluation. Now, she was turning 3. My second visit or the third visit, I guess it would be, we didn't get to because she wound up in the emergency room in the hospital. And for those of you who understand what a normal potassium level is, her potassium level was a 1.7. 3.5 to a 5 is normal. The physician said to me, "I don't know how she's not having a heart attack or a stroke at age 3. She wasn't. And I remember that day very clearly because I feel like she wasn't having a stroke or a heart attack because she's a fighter, and she has been her entire life. So I'm here to tell you that I failed biology in high school. I always say if I knew I was going to give birth to a science experiment, I may have paid attention. I didn't. However, I've had people ask me if I'm a nurse. I've had people ask me if I'm a doctor, and it's been 35 years of my life. So the opportunity to come here and speak is extraordinary. So when Laura was 3, she, again, presented in the hospital. She was admitted. She was in intensive care. It was god-awful because nobody knew. And nobody would say, "I don't know." They just kept poking, prodding, x-rays, tests. It was awful. After day 5, they called a pediatric nephrologist because her kidneys were coming back, some functions were coming back elevated. Let's take it that way. Pediatric nephrologist had to be called into the hospital at that point because they didn't have a staff doc. He came in, he stood at the door of the ICU. She's in one of those, I used to call them cages, I hated them. And he just talked to me. And I said, for the first time in 3 years, I felt like somebody was listening to me. I wasn't the overreactive mother. I wasn't the hovering mother. He was asking me questions, and I was giving them answers about her first 3 years of her life. That led us on the course of a diagnosis, which took another 3 months to definitively diagnose her, because the only way to diagnose cystinosis definitively is by a white cell cystine test, or seeing the corneal crystals in her inner cornea, obviously. So we had to get an appointment with a pediatric eye specialist, which we did. Took 3 months. We got in. And I'm going back 35 years. We got in. The doctor looked in her eyes, didn't say anything, and he went over to his shelf and pulled a book down out of his shelf and had to open the book, had to look at the slides, went back and looked in her eyes, came back and looked in the book 3 times, and he saw the corneal crystals. That led to the definitive diagnosis. The pediatric nephrologist knew of a clinical trial that was going on at the NIH. He made a phone call, and that doctor called me himself. He asked her history, her life story. Yeah, I think I can see her. We started on our first journey down to the NIH from Long Island, and I always describe the NIH at that time, and this was just on the cusp of the AIDS and breast cancer advocates that in some cases became militant because they had to. And we were just on the outside looking in the rare disease community. I didn't understand anything. I'm listening to what you would just say, PTABs, whatever. I'm like, I know NIH, FDA, I know what that, but I don't, the acronyms just boggle my mind sometimes. But we went down to the NIH, we got into the protocol, and after, I guess, 3 or 4 days, and again, some testing, understood that if she couldn't get help there was nothing else. Somebody referred to it as the place of last resorts. If the NIH can't help you, nobody can. The doctor there is, till this day, a phenomenal human being. Dr. William Gall is just, in my mind, is up here. He accepted her into the study, but then it meant my child went from taking no medications to now having to take 6. Some of it was liquid. She's 3.5 years old. That wasn't going to happen. And it was almost 2 years worth of fighting every 6 hours because the medication had to be given every 6 hours. I look back at those days and I don't know how I survived. I think I just functioned, and we're still here, so it must have worked. But it was an extraordinary experience, and my eyes began to open up. As I indicated, I did notice at the NIH the activism around, you can't get anywhere near the clinical center today, but back in those days, there was no gates, there was no fences, there were no guards. You could walk onto the grounds of the NIH without a problem. But I started to see the groups of protesters. I was noticing that, and being caught up in your own, it was here, but I wasn't really, I was focused on my own child. And eventually I understood what they were doing. They needed their voices to be heard. And that was the way they were going to be heard. So we would go back and forth every 4 months to the NIH, just reevaluations, adjustments, and medications. The whole time we go home, and every 6 hours I'm fighting with the 3.5, a 4, and a 5-year-old trying to get medication into her. Somehow I did. When she was maybe 7 or 8, and then we were also being treated locally in New York on Long Island. We happened to have had a phenomenal pediatric nephrologist who followed us. He followed Dr. Gall at the NIH. So there was a communication also, which I think was extraordinarily critical. At the same time, I found the community of cystinosis and started to attend their yearly, every other year, family conferences and listened, learned. Doctors were brought in, but I also felt I wasn't alone. there were other families. Now, just as a numbers perspective, cystinosis is a disease that affects about 500 in the United States, 2,000 worldwide. Without that Orphan Drug Act, we would have no medication. Cystagon, which was the FDA-approved drug that Laura was on pre-FDA approval, she's still on it. She's 38. She's the first generation that has lived that long on this FDA-approved drug. It was an extraordinary time. I can't even cite so many of the things, but I realized early on we weren't alone, to the point where Dr. Gall at the NIH knew of 2 other families who had daughters the same age, so he always let us schedule our appointments together. One was from Ohio, one was from Florida, and we were from New York, because they weren't alone. And they knew one was good at giving blood, one was good at taking medicine, and I forgot what the third one was good at, but probably my daughter, and that was talking. It was an extraordinary time. So FDA approval came through for Cystagon, and then the research, now you have an FDA-approved drug, you're really left to your own accord because the protocols shut down, basically. Dr. Gall was gracious enough to be able to let us come periodically. In the meantime, we have a cystinosis foundation. I was able to network with NORD because one of our leading researchers was actually the first medical director of NORD, Dr. Jess Taney. I'd listened to him at conferences. I did do a lot of listening. But when it came time to advocating, my advocation had to go for her and her health, her hospital stays, her extraordinary care, sometimes changing medications, adjust this, adjust that. And at the same time, I had another child who I had to focus on as well. And for some reason, he turned out okay. Some days I wonder, but I don't know how. But the world of rare disease came into my life in a way that I started to understand. Without that Orphan Drug Act, as I said, Cystagon would never have gotten approved. I believe it's number 41 or number 42 on the list of first 100 drugs approved, subsequent to the piece of legislation. Somewhere along the way, one of my cystinosis families who thought I had a clue decided, you'd be really good on that NORD board. And I did serve on NORD's board for 6 years. Again, opened up a world of the importance of Washington, who your legislators are, who your elected officials are. At the same time, we had networked with the drug companies who were making our kids drugs. As a very, very good friend who passed away a few years ago said one time, if you don't have the families, you don't have the medication, and you don't have the research. So you need all 3. As the family support group and the patient advocates, we needed those families. So we evolved into the Cystinosis Research Network. We have a conference every other year. Try to put it around the country because our population is so small. You give different people opportunity to attend. We have scholarships. We do everything. And our last conference was held in July last year in Nashville. We had over 300 people at it. When you think of a disease that affects 500, we had almost 300 people. There was almost 100 families that came. Again, it was post-COVID, so there was a lot of reasons why, but it was extraordinary. But as I said at that conference, sitting next to Dr. Bill Gall and Dr. Jess Taney, I wanted the community to realize things don't just happen. You have to make them happen. How do you do that? You have to advocate. You have to learn. You have to listen. You have to see who the players are. One of my first experiences going to Washington was I had an opportunity with NORD to go to Washington, go see my congressman, got into his office. He was over at Capitol Hill. They apologized. He was running late, but he came in. But I was sitting in that office, and I thought, what the hell am I doing here? Looking around at pictures of every elected official and everything. But I had the story, and I had to tell the story. And as was said earlier, that's the impact you make, and I've realized that. So I am so grateful for this opportunity to be able to share some of that story. We're not over yet. She's 25 years kidney transplant survivor, 7-year breast cancer survivor. And I said, just for fun, last year decided to have her gallbladder out. So she's calling me this morning and say, did you get there okay? So she's okay, and she's thriving, and she's doing well. That's my job. So she's 38 years old. She's still here. And I am soon to be retired in May. So even though my bio says assistant to the public information officer for the town of Oyster Bay, I will be the retired assistant, because this is where I think my passion is. And I thank you for the opportunity.